Good morning. My name is Julie Gleave, and I am doing a career profile on a child life specialist. The person that I interviewed is Allison Rauscher, and she works at Banner Health Hospital in Mesa, Arizona. She's been a child life specialist for about 8 years now, and she really likes it. She said that her work environment kind of varies. She typically works 40 hours a week, but so she's full time, but there are other people that have that position that only work, maybe part-time or maybe every other Saturday. She said her boss is pretty flexible with letting her have different hours if she has a family emergency or something. Um, Typically, she will spend like 2 days a week up in surgery with children, and then she'll spend maybe a day or two up in radiology, and sometimes she works in an infant toddler section, and she really enjoys that. Um, she said that there's not a lot of room to move up in this career, at least her experience has been that. And so you really have to enjoy what you're doing. And she does enjoy it. Typical stressors for her. She said one of the hardest parts of her job is the bereavement factor. So if you have a family that comes in either to the IR or to the ER or to get a surgery and the child passes away, it's really stressful to be there with the family and to watch them mourning and grieving and going through that process, but it is part of the job. She also said that it can be really stressful when these children are having medical procedures that are uncomfortable or they're scary for them, and to have to be there and walk them through that procedure and stay there with them and watch them be stressed out. That can be kind of a hard thing. The other thing she said that can be stressful is sometimes the staff in certain hospitals that she's worked at do not recognize child life specialists as professionals. They just kind of think they're people that come in and do play therapy. And so that's been a little bit of a stressful situation for her, trying to get people to treat her as a professional in certain situations. She said the benefits are great. Working for a hospital that has great benefits. She says she has lots of PTO days off, and she has really good medical insurance. Common job tasks are to help with pain control. She does a lot of family and patient education before a procedure is going to take place. She'll meet with that family and let them know, usually through dolls, and let them know kind of what to expect, and she just makes it age appropriate for that child. So if it's a little 2-year-old and they're going to be getting an IV, she might show that the doll is going to get an IV and teach them that way. She also helps take kids through the playroom as they're recovering. She will help take in donations from the public, and that helps, with their program. She will explain, like, if a child is going to be going through an MRI or any other kind of procedure, she'll explain that as well. A lot of times she works with the staff, and she helps the staff learn how to just interact with the families better, since the families are going through such a hard time. Usually it's helpful to, sometimes nurses get so caught up in what they're doing and the whole taking care of the physical needs that sometimes the emotional needs need a little bit more attention, and so she helps with that. The educational requirements for this position of child life specialist are it does require a bachelor's, and so Allison got her bachelor's. She actually got her bachelor's in behavioral health, and then she got a minor in family studies. Also, to be a child life specialist, you have to be certified with the Child Life Council. So you have to take a big test for that. She actually flew back to Dallas to take that test because it's not offered often enough here in Arizona. So she wanted to go fly back and do that. And then every 5 years, you need to get recertified through the Child Life Council, and that requires 50 hours of professional development classes. So the starting salary range for this profession is around $37,000 a year, And it can go, she said she's been doing her job for 8 years and she's only received about $3,000 worth of raises. So there hasn't been very many raises. But I know that depending on what state you're in, the salary for this job can go all the way up to like $65,000. So she did say that people, she did an internship with Banner Health, and that's how she was able to get this job. She said about 30 people per semester apply for an internship, and only one person gets it. It's extremely competitive in this field. And she said that once people get a job at a certain place, they have a tendency to kind of stay there. And so there's not a lot of movement around in the field. And there are some hospitals that don't even have child life specialists. So maybe as the word gets out more and this field grows a little bit more, then there will be a greater demand for child life specialists. She did say that there's, in her experience, there's kind of a high burnout rate. It is a very emotionally demanding job, and so she'll see a lot of people come in and after 8 or 10 years they're done and they go on to a different field because it is pretty emotionally demanding. She's back to the internship. She did mention that the one gal that had just gotten that just fulfilled her internship with their hospital there 2 years ago, it took her an entire 2 years to actually get hired on at that hospital because there just weren't any openings. So it is an extremely competitive field. I know that it takes 560 hours to fulfill an internship there, and then you have to take the big test, and you also have to work for 100 hours volunteering before you can even apply for the internship. You need to have worked 100 hours in a hospital setting, and then also work with well children for 100 hours and have like a 3.0, minimum 3.0 grade point average. I got my information sources, of course, from Allison Rauscher, who is a child life specialist at Banner Health Hospital. I also got some information on childlife.org, on ArizonaChildLife.org, and on www.bannerhealth.com. I also wanted to mention that ArizonaChildLife.org does a yearly conference, and there's a lot of people there that are recruiting, and it's a really great place to get career information, so I'll definitely be checking that out. This was really helpful for me to talk to Allison. I learned a lot about this profession and what she does, and kind of the high points and the low points, and it was very enjoyable to talk